I am a breast medical oncologist, and so for breast oncology, I think that two of the big updates that we had this year were the NATALEE trial. NATALEE looked at high-risk, hormone receptor positive, early stage or curable breast cancer, and took patients that were randomized to either adjuvant endocrine therapy, our current standard of care, or adjuvant endocrine therapy plus ribociclib. We already have seen the results of the monarchE study, which was similar using abemaciclib. The NATALEE trial had a slightly lower risk population. It included patients with N1 and even some N0 patients. And so the NATALEE trial, we have known for a while now. The press release came out and told us it had met its primary endpoint of invasive disease-free survival. So we got the data here. It's a relatively early time point. The NATALEE trial is giving us about a 2-year follow-up. Patients take ribociclib for 3 years on the NATALEE study, so most patients are still actively using the drug, but having that first interim analysis, second interim analysis that shows an improvement in invasive disease-free survival at this early time point is really exciting. And based on what we've seen with other CDK4/6 inhibitors, we hope to see those curves continue to separate as the data matures. We have to wait to see if this follows with the drug approval, but I think it hopefully will expand options for our patients with early stage disease. Some earlier lower risk patients may be able to add a CDK4/6 inhibitor to continue to improve their outcomes. Some patients, we can again engage in that. Patients are the cornerstone of care, shared decision making, where we talk about the side effects of one drug versus another, links of therapy, and decide which the best choices are. Another exciting abstract we saw was we got an update on that monarchE study, specifically in the over 65 patient population. Often that cohort is underrepresented in clinical research, and we saw that that over 65 population continued to do just as good as the younger patients on the monarchE study, saying that abemaciclib is well tolerated by older patients. Interestingly, despite not having a significantly increased risk of toxicity, we did see a higher rate of dose reductions, which is interesting. It probably plays a little bit into maybe our bias as investigators, or maybe our bias as patients about what we think we're tolerating or not tolerating. Embedded in that presentation, they released data about how patients who had a dose reduction did in terms of their long-term outcome. And they gave us that data not just for the age over 65 population, but for all comers. And what we saw was that patients who had their abemaciclib dose reduced had virtually the same outcome as patients who didn't. And I think that's really important for us in the clinic when we're counseling patients about why a dose reduction might be good for them.